Let's play Body Recall.
Click on one of the 12 tiles to see what lies underneath it. Remember what you see. Concentration is the key. The object of the game is to match each picture with its name or with its function.
Liver. Kidneys. Brain. Stomach. Heart. Lungs.
Great job!
Shoulder. Pelvis. Knee. Elbow. Vertebrae. Ankle.
Well done!
Larynx. Intestines. Gallbladder. Pancreas. Ear. Uterus.
Great job, Doctor! Body Theater. To select a movie, click on one of the 5 movie icons displayed across the bottom of the screen. To play the chosen movie, click on one of the 4 play buttons displayed on the right side of the screen. Use the scroll buttons to display additional movie icons.
Brainstem. Pituitary. Cerebellum. Occipital lobe. Parietal lobe. Temporal lobe. Frontal lobe. brainstem, pituitary, pinna, eardrum, ossicles, semicircular canals, cochlea, cranial nerve 8, pinna,
Right atrium. Tricuspid valve. Right ventricle. Pulmonary valve. Pulmonary artery. Left atrium. Mitral valve. Left ventricle. Aortic valve. Aorta. Tibia. Femur. Pelvis. Sternum. Cervical spine. Skull. Thoracic spine. Lumbar spine. Scapula. Cervical spine. Thoracic spine. Lumbar spine.
esophagus, stomach, fundus, pylorus, duodenum, jejunum, ileum, ascending colon, transverse colon, descending colon, sigmoid colon, muscle cell, myofibril, actin, myosin, muscle
Right atrium. Tricuspid valve. Right ventricle. Atrioventricular valves. Pulmonary valve. Pulmonary artery. Left atrium. Left ventricle. Aortic valve. Aorta. Right atrium. Tricuspid valve. Right ventricle. Atrioventricular valves. Pulmonary valve. SA node. AV node. Bundle of His. SA node. Myocardial infarction. Pupil. Pupil. Retina. Sclera. Retina. Lens. Iris. Cornea.
Prepare for body imaging and exploration.
Click directly on the body to begin exploring. To move the body to a new position, click on the Rotate Body icon. Use the arrow keys or move the mouse to rotate the body. Click the mouse or hit any key to get a cursor. Divisions of the brain. The surface of the cerebral hemispheres is folded into deep fissures, sulci, and bumps, gyri, which triple the total surface area. The most prominent sulci are used to divide each cerebral hemisphere into 4 main lobes. For example, the central sulci separate the frontal lobes from the parietal lobes. In the 3D model above, the frontal lobes are shown in light blue, the parietal lobes in pink, the temporal lobes in dark blue, and the occipital lobes in green. These lobes have the same names as the skull bones that overlie them. Besides the all-important cerebral hemispheres, the other large structures of the brain visible in the 3D model above are the cerebellum, shown in yellow, and the brainstem, which is shown in orange. The brainstem is the most primitive part of the brain. It is responsible for sustaining the basic functions of life, such as breathing and blood pressure regulation. The brainstem directs these functions without any conscious intervention. The last structure visible in the 3D model above is the pituitary. It is seen as a small reddish ball protruding from the bottom of the frontal lobes. The pituitary is the master gland in the body. It has significant influence over many of the body's processes. The pituitary controls these functions by releasing hormones. Hormones are chemicals that are released into the blood and carried to distant parts of the body where they exert their effects. 2 of the many pituitary hormones are thyroid-stimulating hormone, which controls the thyroid gland, and growth hormone, which stimulates cell division and growth. The eye.
Save the patient.
The eye
It's
is a
up to
complex
you.
organ that provides the sense of sight. The eyeball has a tough outer coat called the sclera, which forms the white part of the eye. The circular, most forward part of the eye is
we
called
just
the
received
cornea.
4 new admissions,
The cornea
and they
is
are all in
transparent.
serious
Behind
condition.
the cornea
To
is a
interview a
fluid-filled
patient,
space called
get
the
more
aqueous
information,
humor,
or start a
watery fluid.
procedure, just
Moving
click
further
on
back,
the
there is
appropriate
colored part of
console.
the eye called the iris,
Click to
with
start.
a black hole in its center called the pupil. The iris changes the size of the pupil in response to changes in brightness. Directly behind the iris is the lens. The lens changes shape to help focus the light rays entering the eye. But surprisingly, most of the
Doctor,
focusing of light
I was
rays
bitten
is
by
done
a
by the cornea.
crazy dog yesterday, and
The
I'm
main
really
body of the
scared.
eye behind
The
the
bite
lens
hurts a
is
lot.
filled with a
I wasn't
clear
even doing
gel
anything to
called
the
the
dog.
vitreous humor.
My mom's
At
worried
the
I might
very
get
back of the eye
rabies.
is the retina.
She said you were going
The
to
light
stick me in the
rays fall
stomach
on
with
the
a bunch of
retina,
really
which
big
converts
needles.
those light rays
Can
into
I leave
signals
now?
that are processed by the brain, allowing us to see. The eyeball itself is moved by 6 delicate muscles called the ocular muscles. 4 of these muscles are shown in the 3D model above. The ear.
The ear is the organ of hearing and balance. The ear is commonly divided into the outer ear, the middle ear, and the inner ear. You have been transported into the patient's brain, which is designed to find and zap all the viruses to cure him. At the end of the ear canal, your patient was bitten by a mad dog just yesterday. The eardrum is avoid damaging healthy cells. 3 tiny bones, ossicles, that form a chain. These bones are the malleus, or hammer, incus, or anvil, and stapes, or stirrup. The airspace within the middle ear is blocked from the outside by the eardrum, but it does connect to the throat via the eustachian tube. The inner ear consists of the cochlea, the semicircular canals, and
You
the
cured the patient
cranial
of
nerve.
rabies.
The base of the stapes.
Rabies is a
fills
viral
the oval
infection of the
window, which
nervous
serves
system.
as the entrance
The
to
virus is
inner ear.
transmitted to humans by rabid animal bites. Many cases are the result of dog bites.
The skull.
Raccoons and bats are other common carriers. Worldwide, there are an
skull
estimated
consists of the cranium,
15,000
which surrounds
cases
the
of
delicate
rabies
brain
each year.
and the facial bones.
There are very few cases
The
in the
cranium is
U.S.,
formed by
however,
8 bones.
largely as
The
a result
frontal
of
bone,
intensive
2
efforts to
parietal
vaccinate
bones,
dogs.
2 temporal bones,
Untreated cases are
occipital bone
usually
in the back,
fatal.
the ethmoid
Treatment
bone
is given
behind
to
the nose,
patients when there is
and the
reasonable
sphenoid bone.
suspicion of
The
rabies
face
exposure
consists of
following an
14
animal
bones,
bite.
including
The primary
maxilla,
treatment
upper jaw,
involves a
and
several-week
mandible,
course
lower
of
jaw.
anti-rabies
The bones
antibody
of the
shots.
skull are quite hard,
The treatment
and
works by
protection of the
enabling
brain
the
is
body to
undoubtedly their
eliminate
most
all the
important
rabies
function.
viruses before the disease
Interestingly,
develops.
several of the bones are hollow,
Fortunately, the
a
medicine
feature
has
which reduces
changed,
their weight.
and it is no
Imagine
longer
how heavy
administered
your head
through the
might
stomach.
feel after a long day if these bones weren't hollow. These air-filled spaces are called the paranasal sinuses because they are located all around the nose. The membranes which line the
that
sinuses
hurts.
sometimes become inflamed
Don't
because
poke
of
me in
allergy
the belly
or
like
infection.
that.
This is a common condition referred to as
Stomach's been
sinusitis.
hurting since yesterday
All the
morning.
skull bones, except the mandible,
I vomited
are held
twice
together by
yesterday, and now I
immovable
have
joints
diarrhea.
called sutures. The mandible
Today
and
I
the 2
even
temporal
collapsed at
bones
work
are held
because I
together
felt
by
so
3
lightheaded.
movable joints, which are named,
Doc,
not
please
surprisingly,
help me.
the
I'm feeling
temporomandibular joints,
really sick.
TMJ. The TMJs usually work well to permit all the complex motions required for chewing and talking. Some people, however, develop pain in their TMJs. This condition is called temporomandibular joint syndrome. TMJ syndrome is usually the result of spasm of the chewing muscles. Headaches, facial pain, and various popping noises are all common in patients with TMJ syndrome.
You have been
Treatment is generally
transported to the
directed at
patient's
reducing the
lungs.
muscle spasms
You will
and
need to
relieving
go
the pain.
exploring to find all the
Besides protecting
viruses.
the brain,
Your
the other
mission
major
is
function
to
of the
eliminate the
skull
viruses
is to
in order
house
to
the
cure
special
her.
sense organs.
Remember,
The
she has been
eyes,
suffering
vision,
from nausea,
ears,
vomiting,
hearing,
and diarrhea
nose,
for 2 days.
smell, and tongue.
Avoid
taste
zapping
are
healthy
all
cells.
located in the skull. The
Hurry!
sense of taste is accomplished by the approximately 10,000 taste buds. These are mostly located on the tongue, with a few located at the back of the throat. Surprisingly, there are only 4 different tastes that can be differentiated by the taste buds alone: bitter, salty, sour, and sweet. The taste buds for each of these 4 different tastes are grouped together on the tongue. Of note, the taste buds for sweet are all located at the very tip of the tongue. Our ability to distinguish a rich range of tastes is actually due to our sense of smell, which is much more developed than our sense of taste. The sense of smell is accomplished by special nerve endings that all sit in a small region in the roof of the nose. Our sense of smell is remarkably sensitive. As few as 4 individual molecules can produce a recognizable smell. The larynx.
The larynx is the organ commonly referred to as the voice box. The 3D model above shows 2 of the major components of the larynx, the cricoid cartilage and the arytenoid cartilages. Each of the 2 vocal cords is tightly stretched between one of the arytenoid cartilages and the cricoid cartilage. Together, the vocal cords form a V structure which vibrates when air is passed over it. Speech is accomplished by moving the vocal cords while they vibrate in order to modulate the sounds that are made. The other major function of the larynx is to prevent choking. Whenever a person eats or drinks, a structure called the epiglottis covers over the entrance to the larynx to prevent swallowed food from entering the lungs.
Marvelous work! You cured the patient of gastroenteritis.
Is the thyroid gland, which lies just in front of the larynx.
Gastroenteritis is a common
The
cause of
thyroid gland
abdominal
uses
pain and
iodine
vomiting.
to make thyroid
It is caused
hormone.
by any of a large
This
number of
hormone is
different
released into
viruses
the
or
bloodstream,
bacteria
where it
that a
plays a
person may
very
be
important
exposed to
role in
by consuming
regulating overall
contaminated
body
food or
metabolism.
water. This
People
case
with
of
underactive
gastroenteritis was
thyroid
caused
glands
by
feel
a
quite tired
rotavirus
and
infection.
sluggish. In contrast,
Symptoms can vary
people
from
with
mild to
overactive
very
thyroid
severe.
glands experience
Generally,
rapid heart rate,
gastroenteritis
sweating,
lasts
anxiety,
only a
weight
few
loss,
days and
heat
resolves without
intolerance.
any problems.
The
Treatment
most common
depends
cause
mostly
for
on
overactive
replacing lost
thyroid
fluids.
gland is Graves' disease.
It's time to see another
Graves'
patient.
disease is an example of an autoimmune disease in which inappropriate antibodies are made which bind
Doc,
to the
I've been feeling
thyroid
terrible
gland
for
and
3
stimulate
days
it
now.
to produce too
I can
much
hardly
thyroid
move.
hormone.
Never been this
This
sick before.
problem is usually
I
treated
have a
by
high fever.
administering
I'm having a
radioactive
hard time
iodine,
breathing.
which kills off the
Keep
excess
coughing,
thyroid
coughing.
activity when it is taken
Hardly
up
anything
by
ever
the
comes
thyroid.
up. Tylenol
Studies
helps make
have
my
shown
fever
that
go
this
down.
treatment is not
Still
only
feel like I'm gonna
effective but
drop
entirely
dead.
safe with no increased
Please help
incidence
me.
of cancer.
Just don't know what to do.
Another cause of excess thyroid activity is Plummer's disease, a disease in which one or a few specific thyroid nodules overproduce thyroid hormone. This can also be treated with radioactive iodine, but it is usually more effective to remove the overfunctioning nodules surgically.
You have been
When
transported
doing
to the
thyroid
patient's
surgery,
heart.
it is very important
will need to go
not to damage the 4 tiny parathyroid glands which lie above and below the thyroid on both sides. These glands play a major role in the regulation of body calcium. This is an important job because nerve and muscle cells only function correctly when the blood calcium level lies within a very narrow range.
The shoulder. The shoulder is a ball and socket joint which connects the arm with the body. 3 bones come together to form the shoulder joint. These bones are the humerus, arm, the clavicle, collarbone, and the scapula, shoulder blade. The deltoid muscle sits on top of the upper arm and shoulder. This powerful muscle works to lift the arm away from the body. There's a fluid-filled cavity under the deltoid muscle, which serves to reduce friction between the muscle and the underlying joint. Occasionally, this cavity becomes inflamed and painful because of excessive motion. This condition is called bursitis. Bursitis can also occur at a number of other joints, including the elbow and knee. The tendons of 4 muscles merge together around the shoulder joint to form a reinforcing structure called the rotator cuff. Great job! The rotator cuff
cured
can
the
be
patient of
damaged by
pneumonia.
excessive stress.
Most
This
cases
is
of
why
pneumonia
rotator
are
cuff
caused by either
injuries are common
bacteria
among
or
professional
viruses.
athletes,
In this
especially
case, the
baseball
patient's
pitchers
illness was
and
caused by an
football quarterbacks.
influenza virus infection.
Another common problem
This is a very
dislocation
unusual
of the
cause of
shoulder.
pneumonia.
In this case,
Although
the
there
top
is
of the
no
arm,
specific
humeral
therapy
head,
for this viral
comes out of
illness,
its normal
it is
socket,
difficult to distinguish
glenoid cavity.
influenza virus
Some people have
pneumonia
relatively
from the more
lax
commonly
shoulder
seen
muscles and are
bacterial
prone to
pneumonias.
shoulder dislocations.
This patient would thus have been treated with antibiotics, as if he had a bacterial
lungs.
pneumonia, such as pneumococcal pneumonia. A failure to respond to
The lungs are a
antibiotics as
vital
expected
organ which enables
is
the
often
body
the
to
clue
obtain
that
oxygen
signals
from the air
doctors
we
to look
breathe
for an unusual
and to eliminate
viral
carbon
cause,
dioxide.
as in this case.
Breathing is accomplished
It's
with the
time to
chest
see
wall
another
muscles
patient.
and the diaphragm muscle, which separates the chest cavity from the abdomen. When the chest cavity expands, the lungs expand
Doc,
with it, drawing air
for the
down
past
into the
few
lungs.
months, Whenever I
When the
walk
chest
up
cavity
the stairs in my
relaxes,
house,
the
I feel
lungs
pressure
shrink,
in my
and
chest.
waste carbon dioxide is
Pain has been
expelled.
getting worse lately.
The lungs are not directly
Sometimes I
attached to
even
the
feel
chest
pain in
wall.
my jaw.
Instead, they are encased in
shoulder.
a double-layer membrane
When
called
it's
the
really
pleura.
bad, I have to
One of the
sit down
pleural
for a
layers
while.
is firmly attached
Pain
to the
seems to go
lungs,
away.
with the other one firmly
I don't know what
attached
to
to the
do now.
chest wall. There's
Making it
always a
hard just
small
to get
amount of
through the
fluid
day.
between the two pleural layers, which allows them to freely slide over each other. The lungs are divided into distinct lobes, which are supplied by their own airways, bronchi, and their own arteries. On the right side, there are three main lobes called the upper, middle, and lower lobes. On the left, there are only two lobes called the upper and lower lobes. This anatomy is illustrated in the 3D model above.
You have been
The
transported
fissures that
into the
separate the
patient's
upper and lower
stomach.
lobes on both sides
Find all
are
of the
called the major
cholesterol plaques
fissures.
in the patient's
The
arteries
right
and
lung
zap
also
them.
has a minor
This
fissure
will
that
relieve the
separates the
patient
upper
of his
and middle
disabling
lobes.
chest pain.
Notice how the minor fissure is nearly horizontal, but the major fissures run at a steep angle. When a doctor listens to the breathing sounds on your back, he or she is listening to the lower lobes, even when the stethoscope is placed high up by the shoulder blades. One of the disorders sometimes seen in the emergency room is collapse of the lung. Surprisingly, the natural tendency of the lungs is to collapse into a small ball near the center of the chest. They are held in their normal expanded state only by the attraction between the two layers of the pleura. If you have ever tried to separate two sheets of wet glass, then you know how this works. Occasionally, air gets between the two pleural layers, causing them to separate, and the lung collapses. This is called a pneumothorax, meaning air in the thorax, chest cavity. The air can either come from the outside because of a penetrating wound, or from the inside because a part of the lung developed a hole in it. Another problem that is sometimes seen is excess water between the two pleural layers. This is called a pleural effusion, a condition commonly referred to as water on the lung. There are many causes for a pleural effusion, some benign and some quite bad. A pleural effusion is typically treated by sticking a needle or a tube into the chest and draining out the...
Very well done. You cleared the cholesterol
The
plaques
heart.
from the patient's arteries. The patient had symptoms of angina pectoris. Angina occurs when the oxygen supply to the heart
is a
muscle
powerful
is
pump that beats
inadequate to meet the heart's
continuously during
demands.
life to circulate
The
the
heart is
blood throughout
deprived
the
of
body.
oxygen, and the
The
patient
heart has
experiences
4
pain.
separate chambers.
Most
There are
commonly,
2
angina
atria
occurs
to
with mild
receive the blood
stress or
returning to the
exercise.
heart, and 2
Angina is
ventricles
caused
to
by
pump the blood
narrowing
back
of the
out.
coronary arteries,
Each of
usually
these
due
4
to a
chambers
buildup of
has a
cholesterol
one-way
plaques.
valve to ensure
The
that
pain
blood
can be
flow is
relieved
always
with medication,
in the forward direction.
but definitive treatment requires
The heart is
intervention
actually better
to restore
described
normal
as
blood
2
flow to the
pumps
heart
that
muscle.
act in series.
Coronary
With
balloon
each beat, the
angioplasty
right
and
ventricle
coronary
pumps
artery bypass
deoxygenated
grafting
blood to the
are the
lungs,
most common methods
and
of
the
definitive
left
treatment.
ventricle pumps oxygenated blood to
Congratulations.
the body.
Now see if you
The
can cure
two
all the
sides of
patients
the heart
faster.
are not identical, however. The left ventricle is much thicker and stronger than the right ventricle. Why is this so? It is easy to see that the right and left sides of the heart must always pump the same volume of blood. If they didn't, serious bottlenecks would develop in the circulation. However, the resistance to blood flow is much greater in the body than it is in the lungs. The left ventricle, thus, has to work harder and contract
The
more
brain.
forcefully to keep up
This
with the right
photograph shows a
ventricle.
human brain.
This
It is
explains
dominated
why
by the massive
left ventricle
cerebrum with
has
its many
much
deep
thicker
folds.
muscular walls than the
Also
right
seen in the
ventricle.
photograph are the cerebellum, located at the back
Let
of
us
the brain,
follow the course
and
of
the
a single
brainstem.
red blood cell in
The
more
brain
detail
and the
as it
spinal
moves
cord
through the heart.
together form the central
At
nervous
the outset
system,
of the journey,
CNS.
the blood cell returns
The
from the body
CNS is
via
the control
vena
center
cava
for the body.
and enters the right
The lethal
atrium.
effects of rabies viruses
The right atrium
result from
contracts
infection
and
of the
pumps the blood
CNS.
cell across the
Without proper
tricuspid
function of
valve
the
and into
CNS,
the right
vital
ventricle.
functions such as breathing and
Soon after
swallowing
that,
stop
the
working.
right ventricle contracts
Shutdown
and
of the
pumps
CNS
the blood cell
eventually
across
leads to
the
coma
pulmonic
and death.
valve and into the
The most
pulmonary
reliable
artery.
method for determining whether
The
an
blood
animal is
cell can
infected
then
with the
go
rabies
either
virus
right or left
is to
to
examine
enter
an
one of the
actual
lungs.
brain specimen for the
While in
presence
the
of
lungs,
rabies
the blood
viruses.
cell unloads carbon dioxide and picks up oxygen. Next,
Neuron.
the blood cell returns
The
to the
basic
left
function of the
atrium
nervous system
via
is to
one of the
transmit
pulmonary
messages
veins.
from one place to another.
The blood cell then
The nerve
crosses the
cells
mitral
which do
valve
this
to
job
enter the
are
left
called
ventricle.
neurons.
At
Each
this
neuron
point,
has
the
a
left
single long
ventricle
branch called
contracts
an
forcefully
axon,
to send the
which
blood
permits
cell
messages
across
to be
the
carried to
aortic
distant
valve
parts of the body.
and out into the body.
This illustration shows a
After
single neuron
unloading
with its
oxygen
axon
somewhere
in
the
yellow
body,
extending
the blood
off to the
cell
left.
enters a vein and
Normally,
returns via
neurons
the vena
perform their
cava to the
functions by
right
conducting
atrium, where it
electrical
can begin the
signals
cycle
down the
once
length of their
again.
axons.
On average,
Unfortunately,
this whole
these same
journey takes
axons
about
serve as
2
the
minutes.
pathway by which rabies viruses
Red blood
migrate
cells
from the
only
site of an
last
animal
about
bite
4 months
to the
before
central
they
nervous
wear
system.
out. But the
The
heart
further
never
away
rests.
the animal bite is from the
During
central
an
nervous
average
system,
lifetime,
the
the heart
longer it
beats
takes for the disease
approximately
to develop.
2.5 billion times. The heart is a very well-designed
Antibodies.
pump indeed. It is
This
more
picture shows
reliable
several
and
Y-shaped
energy
antibody
efficient
molecules
than any
within a
pump
blood vessel.
ever created by man.
Antibodies are made by the immune system to react with specific foreign invaders, such as rabies viruses.
shoulder.
Treatment
The
for people
shoulder is a
exposed to
ball-
rabies involves administering pre-formed anti-rabies antibodies obtained from horses.
The shoulder. The shoulder.
These antibodies bind to the rabies viruses
The
and help
shoulder.
the body
The
to
shoulder
eliminate
is-
them before they can do any harm. Next, the patient is immunized
liver.
with killed rabies viruses.
The liver
These
is the
viruses
largest and
stimulate the
one of the most
patient's
vital
immune
organs.
system
It
to make its
consists of
own
two main
anti-rabies
lobes,
antibodies.
the right and the left.
Treatment
and a
is
smaller
essentially
third lobe
100%
called the
successful
caudate.
at preventing the
liver is one of
disease
two
when it is
organs,
given
along
within a
with the
few
lungs,
days of
to receive a
exposure to
dual blood
rabies.
supply.
Of historical
receives
interest,
most of its blood,
it was Louis Pasteur
85%,
who first
via
explained the
portal
cause
vein,
of rabies.
which drains nearly
He
all
also
the
developed a
blood from the
method of
intestine.
immunization
This
to
ensures
prevent the
that all
disease
the
from
absorbed
occurring.
food goes directly to the
In the
liver,
1800s,
where it can be
this was a
packaged and
monumental
stored
achievement.
for use when needed. The liver receives the other 15% of its blood from the hepatic arteries.
Rabies
This
virus.
second blood supply is also
This is a
important
picture of a rabies
because the
virus.
arterial blood
The
is
rabies
well
virus is a
oxygenated,
member of the
unlike
family of
venous blood arriving
rhabdoviruses.
through the portal vein.
Infection with the rabies virus causes a serious illness that primarily affects animals, though people can also
stomach.
contract the illness if they are bitten by a rabid animal.
The
Common
stomach
animal
is
carriers
the hollow,
include foxes,
muscular organ
skunks,
where the process
raccoons,
of digesting
bats,
swallowed
and
food
dogs.
begins.
The disease
Its
usually
walls are
begins
quite
2 to 8
flexible,
weeks after
expanding
exposure
to a
to the
volume
virus.
of about 1.5
Early symptoms
liters,
include loss of
3
appetite,
pints,
intense
after a
thirst,
meal.
nausea,
The stomach
vomiting, and
lining
fever.
secretes strong
The virus
acids and
causes its
special
ill effects by
enzymes that
damaging
begin
the
to
central
break down
nervous
the
system.
swallowed food.
It is generally only
The
a few
muscular
weeks from the
walls
onset of
also churn
symptoms
the food,
until the
which
patient
helps
lapses
to
into a
convert the
coma
food
and
into a
dies.
creamy paste.
Untreated rabies is
Of
nearly
note,
universally
the stomach
fatal.
wall also contains
Fortunately,
glands
treatment can
which
prevent
secrete
rabies
mucus.
from developing
This
if
mucus
it is
coats the
initiated
inner
soon
lining
after
of
the
the
patient
stomach
is
and
bitten by
prevents
the
the
rabid
stomach
animal.
from digesting itself. Occasionally, the mucus barrier is disrupted for some reason, leading to the formation of an ulcer. Most ulcers will heal uneventfully with just antacids taken for therapy. Medications that reduce the output of stomach acid can also be used to help heal ulcers and prevent new ones from forming.
The elbow. The elbow is the hinge joint which connects the lower end of the humerus with the upper ends of the radius and ulna. The elbow permits the arm to be bent by the powerful biceps muscle and then straightened by the triceps muscle. The biceps and triceps thus form a pair of muscles which have opposite actions. It is a general rule that the muscles of the body are organized into pairs or groups which have opposite actions. The elbow also allows the forearm to be rotated without moving the upper arm. This is very important for some actions, such as turning a doorknob. This rotation motion is called either supination or pronation. Supination is the action of turning the palm face up when the arm is held straight out, away from the body. Pronation is the action of turning the palm face down when the arm is held straight out. Following the general rule, these important movements are accomplished by a pair of muscles with opposite actions. The words supination and pronation are related to the words supine, which means to lie face up, and prone, which means to lie face down. Repetitive motions can strain the tendons of the elbow and cause pain. Tennis elbow and golfer's elbow are common conditions resulting from overuse and strain of the elbow tendons. Most everyone has felt the pins and needles sensation caused by hitting the tip of their elbow. This is often referred to as hitting the funny bone. The temporary pain is caused by impingement of the ulnar nerve, which travels through a narrow groove close to the surface of the skin as it passes over the elbow. The elbow. The elbow is the intestine.
The intestine is the major part of the digestive system, extending from the duodenum to the anus. It is generally divided into the small intestine and the large intestine. The primary function of the small intestine is to complete the digestion of food and then absorb the useful nutrients into the blood. The small intestine consists of three major sections called the duodenum, the jejunum, and the ileum. At the end of the ileum, unabsorbed material containing a large volume of water is passed on to the large intestine. The function of the large intestine is to resorb all the excess water from the undigested food. This process forms feces, which are then eliminated. The appendix is a tiny finger-like process extending from the bottom of the cecum on the right side of the large intestine. The appendix has no known function. Occasionally, the appendix becomes infected, a condition called appendicitis. Appendicitis is generally treated by simply removing the appendix. This is the most common abdominal operation.
Male reproductive system. The illustration above shows part of the male reproductive system. Sperm production begins in the innumerable seminiferous tubules within the two testes. A close-up of a seminiferous tubule is shown along with the developing sperm cell. Sperm then move into the epididymis where they mature. Shortly before ejaculation, the mature sperm are propelled from the epididymis into a long tube called the vas deferens. The vas deferens carries the sperm to the seminal vesicles, which adds seminal fluid to the sperm cells. The semen then travels along two short ducts to the urethra. Lastly, the urethra passes through the prostate, which adds more secretions to the semen before it leaves the body.
The digital hand. The hand is the most versatile part of the skeleton. It enables people to grasp and manipulate objects. The hand is comprised of the wrist, carpals, palm, metacarpals, and fingers, phalanges. There are three main nerves which travel to the hand: the median nerve, the ulnar nerve, and the radial nerve. Each of these three nerves connects with a specific part of the hand to permit movement and sensation. Intricate hand movements are achieved by using the small muscles that are contained entirely within the hand, the intrinsic muscles, and the much larger forearm muscles. The forearm muscles are connected to the bones of the hand by long tendons. Tendons and ligaments are often confused with one another. A tendon is the fibrous attachment of a muscle to a bone. A ligament is a fibrous attachment between bones. The leg.
The knee is the hinge joint that connects the main bones of the leg, the femur and the tibia. The kneecap, patella, lies over the front of the joint. There are strong ligaments on both sides of the joint called the medial and lateral collateral ligaments. There are also two ligaments within the joint called the anterior and posterior cruciate ligaments. All four of these ligaments serve to connect the bones of the knee and to provide additional stability. Like other movable joints, the bony ends of the femur and tibia are separated by protective cartilage which serves as a cushion between the bones. There are two of these cartilage cushions in the knee. They are called the medial and lateral menisci. The powerful quadriceps muscles are responsible for straightening, extending the leg at the knee joint. These muscles are in the front of the thigh. The kneecap is actually a large bone within the quadriceps tendon. The quadriceps tendon is thus commonly referred to as the patellar tendon. The hamstrings are the muscles which bend, flex, the knee at the knee joint. These muscles are located in the back of the thigh. There are a number of common knee injuries.
Severe twisting of the knee will frequently sprain one of the knee ligaments. The difference between a sprain and a strain is often confused. A sprain occurs when a ligament, fibrous connection between bones, is damaged. A strain occurs when a muscle or tendon is damaged. Running can sometimes injure the knee by straining the patellar tendon. The cartilage cushions, menisci, within the knee are also frequently damaged by severe twisting. A torn meniscus is very painful and usually requires surgical repair.
The foot and ankle. The ankle is a hinge joint connecting the bones of the lower leg, tibia and fibula, and the uppermost bone of the foot, talus. The ankle is held together by several strong ligaments which provide stability and prevent excessive movement. The ankle only allows simple upward and downward motions of the foot. Other foot movements require motion of the joints within the foot itself. Because the ankle is subject to great stress, sprains of the ankle ligaments are very common. Each foot has 26 separate bones. The two largest foot bones are the calcaneus, heel bone, and the talus. Long tendons attach many of the bones of the foot to strong muscles located in the lower leg. There are a number of disorders that are frequently seen in the foot. These include corns, bunions, and gout. Corns are small areas of thickened skin, usually caused by tight-fitting shoes. A bunion is a firm, fluid-filled lesion that forms over the base of the big toe. Like corns, bunions are usually the result of wearing tight, pointed shoes. Bunions sometimes require surgical removal and reconstruction of the great toe to prevent them from recurring. Gout is a form of arthritis that commonly affects the joint of the great toe. Gout results from the formation of uric acid crystals within a joint. These crystals cause significant inflammation and pain in the affected joint. A person suffering from an attack of gout in the great toe is generally unable to even stand on the foot. Unlike corns and bunions, which are more common in women, gout is 10 times more common in men.
Save the patient. It's up to you. Doctor, we just received 4 new admissions, and they are all in serious condition. To interview a patient, get more information, or start a procedure, just click on the appropriate console. Click to start. Doctor, I was bitten by a crazy dog yesterday and I'm really scared. The bite hurts a lot. I wasn't even doing anything to the dog. My mom's worried I might get rabies. She said you were gonna stick me in the stomach with a bunch of really big needles. Can I leave now? You have been transported into the patient's brain. Find and zap all of the viruses to cure him. Remember, your patient was bitten by a mad dog just yesterday. Avoid damaging healthy cells. Great job! You cured the patient of rabies. Rabies is a viral infection of the nervous system. The virus is transmitted to humans by rabid animal bites. Many cases are the result of dog bites. Raccoons and bats are other common carriers.
Worldwide, there are an estimated 15,000 cases of rabies each year. There are very few cases in the U.S., however, largely as a result of intensive efforts to vaccinate dogs. Untreated cases are usually fatal. Treatment is given to patients when there is reasonable suspicion of rabies exposure following an animal bite. The primary treatment involves a several-week course of anti-rabies antibody shots. The treatment works by enabling the body to eliminate all the rabies viruses before the disease develops. Fortunately, the medicine has changed and it is no longer administered through the stomach. Ow! Oh, that hurts. Don't poke me in the belly like that. Oh, my stomach's been hurting since yesterday morning. I vomited twice yesterday and now I have diarrhea. Today I even collapsed at work because I felt so lightheaded. Doc, please help me. I'm feeling really sick. You have been transported to the patient's lungs. You will need to go exploring to find all the viruses. Your mission is to eliminate the viruses in order to cure her. Remember, she has been suffering from nausea, vomiting, and diarrhea for 2 days. Avoid zapping healthy cells. Hurry! Marvelous work! You cured the patient of gastroenteritis. Gastroenteritis is a common cause of abdominal pain and vomiting. It is caused by any of a large number of different viruses or bacteria that a person may be exposed to by consuming contaminated food or water. This case of gastroenteritis was caused by a rotavirus infection. Symptoms can vary from mild to very severe. Generally, gastroenteritis lasts only a few days and resolves without any problems. Treatment depends mostly on replacing lost fluids. It's time to see another patient.
Doc, I've been feeling terrible for 3 days now. I can hardly move. Never been this sick before. I have a high fever. I'm having a hard time breathing. Keep coughing and coughing. Hardly anything ever comes up. Tylenol helps make my fever go down, but I still feel like I'm gonna drop dead. Please help me. I just don't know what to do.
You have been transported to the patient's heart. You will need to go to...
Great job! You cured the patient of pneumonia. Most cases of pneumonia are caused by either bacteria or viruses. In this case, the patient's illness was caused by an influenza virus infection. This is a very unusual cause of pneumonia. Although there is no specific therapy for this viral illness, it is difficult to distinguish influenza virus pneumonia from the more commonly seen bacterial pneumonias. This patient would thus have been treated with antibiotics, as if he had a bacterial pneumonia, such as pneumococcal pneumonia. A failure to respond to antibiotics as expected is often the clue that signals doctors to look for an unusual viral cause, as in this case. It's time to see another patient.
Doc, for the past few months, whenever I walk up the stairs in my house, I feel pressure in my chest. Pain has been getting worse lately. Sometimes I even feel pain in my jaw, my left shoulder. When it's really bad, I have to sit down for a while. The pain seems to go away. I don't know what to do, Doc. This is making it hard just to get through the day.
You have been transported into the patient's stomach. Find all of the cholesterol plaques in the patient's arteries and zap them. This will relieve the patient of his disabling chest pain.
Very well done. You cleared the cholesterol plaques from the patient's arteries. The patient had symptoms of angina pectoris. Angina occurs when the oxygen supply to the heart muscle is inadequate to meet the heart's demands. the heart is deprived of oxygen and the patient experiences pain. Most commonly, angina occurs with mild stress or exercise. Angina is caused by narrowing of the coronary arteries, usually due to a buildup of cholesterol plaques. The pain can be relieved with medication, but definitive treatment requires intervention to restore normal blood flow to the heart muscle. Coronary balloon angioplasty and coronary artery bypass grafting are the most common methods of definitive treatment. Congratulations! Now see if you can cure all the patients faster. The brain. This photograph shows a human brain. It is dominated by the massive cerebrum with its many deep folds. Also seen in the photograph are the cerebellum, located at the back of the brain, and the brainstem. The brain and the spinal cord together form the central nervous system, CNS. The CNS is the control center for the body. The lethal effects of rabies viruses result from infection of the CNS. Without proper function of the CNS, vital functions such as breathing and swallowing stop working. Shutdown of the CNS eventually leads to coma and death. The most reliable method for determining whether an animal is infected with the rabies virus is to examine an actual brain specimen for the presence of rabies viruses. Neuron. The basic function of the nervous system is to transmit messages from one place to another. The nerve cells which do this job are called neurons. Each neuron has a single long branch called an axon, which permits messages to be carried to distant parts of the body. This illustration shows a single neuron with its axon, in yellow, extending off to the left. Normally, neurons perform their functions by conducting electrical signals down the length of their axons. Unfortunately, these same axons serve as the pathway by which rabies viruses migrate from the site of an animal bite to the central nervous system. The further away the animal bite is from the central nervous system, the longer it takes for the disease to develop. Antibodies. This picture shows several Y-shaped antibody molecules within a blood vessel. Antibodies are made by the immune system to react with specific foreign invaders, such as rabies viruses. Treatment for people exposed to rabies involves administering preformed anti-rabies antibodies obtained from horses. These antibodies bind to the rabies viruses and help the body to eliminate them before they can do any harm. Next, the patient is immunized with killed rabies viruses. These viruses stimulate the patient's immune system to make its own anti-rabies antibodies. Treatment is essentially 100% successful at preventing the disease when it is given within a few days of exposure to rabies. Of historical interest, it was Louis Pasteur who first explained the cause of rabies. He also developed a method of immunization to prevent the disease from occurring. In the 1800s, this was a monumental achievement. Rabies virus. This is a picture of a rabies virus. The rabies virus is a member of the family of rhabdoviruses. Infection with the rabies virus causes a serious illness that primarily affects animals, though people can also contract the illness if they are bitten by a rabid animal. Common animal carriers include foxes, skunks, raccoons, bats, and dogs. The disease usually begins 2 to 8 weeks after exposure to the virus. Early symptoms include loss of appetite, intense thirst, nausea, vomiting, and fever. The virus causes its ill effects by damaging the central nervous system. It is generally only a few weeks from the onset of symptoms until the patient lapses into a coma and dies. Untreated rabies is nearly universally fatal. Fortunately, treatment can prevent rabies from developing if it is initiated soon after the patient is bitten by the rabid animal. Rotavirus. The illustration at left shows a single rotavirus. Worldwide, it is one of the most common viruses that can infect the digestive system and cause gastroenteritis. The rotavirus is easily spread from person to person in a family or other group setting. Rotaviruses are also found in a number of animal species. Rotavirus infection is particularly problematic in infants and young children, and it is responsible for many deaths in undeveloped countries, where medical care is inadequate. The rotavirus causes illness by invading the lining of the duodenum and the upper small intestine. The intestinal villi are transiently damaged, but they rapidly regenerate their lining. Illness typically begins with 1 or 2 episodes of vomiting, followed by diarrhea. Uncomplicated cases resolve in about 1 week. Treatment requires only rest and adequate fluid intake to prevent dehydration. The small intestine. The illustration at left depicts a segment of the small intestine. The small intestine is a long tube, about 21 feet or 6.5 meters, whose purpose is to absorb food. The inner layer of the small intestine, the mucosa, is very well suited for this job. It is organized into innumerable little finger-like projections called villi. The mucosal cells which line the villi are in turn covered with even smaller finger-like projections called microvilli. The villi and microvilli greatly increase the surface area with which to absorb food. It is the mucosal cells which line the villi that are most damaged by a rotavirus infection. This disrupts the absorption of food and causes vomiting and diarrhea. The middle walls of the small intestine contain circular and longitudinal smooth muscle layers. Under normal circumstances, these muscle layers contract in rhythmic fashion to force the partially digested food along the whole length of the small intestine. This contraction process is called peristalsis. The outermost layer of the small intestine is called the serosa. Microvilli. The photograph at left shows a close-up of a mucosal cell which lines the inside of the small intestine. Each of the tiny finger-like projections on this cell's surface are called microvilli. If we were further away, we could see that the inner lining of the small intestine is itself organized into many small finger-like projections called villi. The villi and microvilli together create a surface area within the small intestine that is as large as a tennis court. The main purpose of this lining is to promote the effective absorption of food. This is a job it is quite well designed to perform. Endoscopy. The photograph at left shows the inside of a normal duodenum as seen through an endoscope. An endoscope is a flexible tube with both a light and a camera lens at its end. Doctors often use the endoscope to examine the digestive tract when a patient develops vomiting or diarrhea that doesn't resolve as expected. Tiny surgical tools can also be manipulated through the endoscope, allowing treatment of a wide variety of digestive system disorders. The lungs. The lungs are a vital organ which enables the body to obtain oxygen from the air we breathe and to eliminate carbon dioxide. The structure of the lungs can be likened to a branching tree. Starting with the trachea, windpipe, the respiratory tree branches initially to form 2 main bronchi, airwaves, that enter the right and left lungs. The main bronchi then branch again and again, first forming smaller bronchi and then even smaller bronchioles. At the end of the smallest bronchioles, there are tiny grape-like air sacs called alveoli. It is in the alveoli that oxygen comes into contact with the red blood cells that will carry it to all parts of the body. In the rare cases when influenza goes on to cause pneumonia, the alveoli tend to fill up with water and cellular debris. This prevents the red blood cells from picking up oxygen and causes hypoxia. Hypoxia simply means low oxygen. This is the main problem for patients with pneumonia. The respiratory lining. The photograph at left shows a portion of the lining of the upper respiratory tree. The lining consists of two main types of cells, goblet cells and ciliated cells. The goblet cells secrete a sticky mucus which coats the respiratory lining and traps foreign particles. The ciliated cells, shown in orange, have numerous tiny hairs, cilia, on their surfaces which continuously beat in unison. This action sweeps the sticky mucus with its trapped particles up and out of the lungs. Influenza viruses invade and ultimately destroy large numbers of the cells which line the respiratory tree. This, of course, impairs the function of the lining and causes people with influenza to cough. It also makes people more susceptible to other infections, since they are less able to sweep out other potential invaders. Of note, cigarette smoking is also very toxic to the cells of the respiratory lining. This accounts for the chronic coughing and increased susceptibility to upper respiratory infections seen in smokers. Influenza virus. There are three main types of influenza viruses, named type A, B, and C. The schematic illustration at left shows a single influenza virus. Among the most notable features are the little spikes, shown in white, that stick out from the viral surface. The exact nature of the spikes, glycoproteins, determines the type of the influenza virus. Immunity to influenza occurs when the immune system makes antibodies that bind to these glycoprotein surface spikes. Unfortunately, the type A and to a lesser extent type B influenza viruses are unstable, with new versions appearing every year. When a new version appears, the antibodies still circulating in the body from the last bout of influenza will be less effective at eliminating the virus, and the person may get ill once again. Occasionally, an influenza virus will appear that is so radically new that virtually no one is immune to it. When this occurs, the result is a worldwide flu outbreak called a pandemic. Influenza virus. The photograph at left shows a single influenza virus. Influenza viruses are responsible for the respiratory illness popularly named the flu. This illness is spread from person to person through the air by virus-infected water droplets that are sneezed or coughed up. Influenza generally occurs in local outbreaks. Outbreaks tend to occur in the winter months, spreading rapidly through places where many people congregate, such as schools, offices, and nursing homes. The typical case of influenza is characterized by fever, muscle aches, headache, loss of appetite, cough, and a runny nose. The illness typically resolves within a week and does not require any treatment beyond rest and fluids. Rarely, influenza will progress and infect the lungs themselves, causing a severe pneumonia that can be fatal even in young, healthy adults. Most deaths from influenza, however, occur in old people who develop bacterial pneumonia because the viral infection lowers their resistance to other infections. Coronary artery disease. Atherosclerosis is a disease which results in narrowed arteries and decreased blood flow. The arteries become narrowed because of a buildup of plaques within their inner walls. This illustration shows a yellow plaque within the inner layer of an artery. Plaques consist of a mixture of substances, including cholesterol, fat, fibrous tissue, clumps of platelets, and sometimes calcium. Atherosclerosis begins early in life, but generally causes no symptoms until middle or old age. Only after an artery becomes very narrowed will blood flow be diminished enough to cause symptoms. When atherosclerosis affects the coronary arteries, it is called coronary artery disease. Patients with coronary artery disease experience chest pain when the blood supply to the heart is inadequate to meet the demand for oxygen. This pain is called angina. Coronary artery disease is a very common ailment with characteristic symptoms. Angina typically occurs after a predictable amount of exercise, for example walking up one flight of stairs, and is relieved by rest. Medication is available that relieves the pain by briefly dilating the coronary arteries, but this has no effect on the underlying disease. Patients with angina are at high risk for having a heart attack if their coronary artery disease is not treated. The heart. Although the heart is constantly pumping blood, it does not actually receive any oxygen from the blood which travels through its chambers. Instead, the heart receives all of its oxygen from the arteries which encircle it. These blood vessels are known as the coronary arteries. This illustration shows the heart and the coronary arteries. Under normal circumstances, the coronary arteries have significant reserve capacity, and they can easily meet the oxygen demands of the heart muscle. Problems with supplying the heart muscle with oxygen arise only when the coronary arteries become narrowed due to atherosclerosis. Coronary angiography. It is often desirable to study the coronary arteries of patients with coronary artery disease. Many different tests have been devised to do this. At present, the definitive test for evaluating the coronary arteries is angiography. Coronary angiography is an invasive test that requires placing a catheter in the coronary arteries. Dye is then injected, and detailed pictures of the coronary arteries are obtained. This test enables doctors to determine the exact location and severity of the plaques within the coronary arteries. The photograph at left shows a doctor performing a coronary angiogram. Several new forms of treatment for coronary artery disease have emerged in recent years. The most well accepted is coronary angioplasty. Coronary angioplasty involves positioning a small balloon catheter in a coronary artery such that the balloon crosses a plaque. The balloon is then inflated to compress the fatty plaque and make it smaller. When the balloon is deflated, the plaque usually remains compressed. This increases the size of the arterial lumen, central opening, and improves blood flow to the heart. Heart attack. People with coronary artery disease are at high risk for having a heart attack. A heart attack occurs when the blood supply to a part of the heart is suddenly cut off and the affected heart muscle dies. The usual cause of a heart attack is the formation of a blood clot at the site of an atherosclerotic plaque. The clot completely blocks the artery, cutting off blood flow beyond it. The medical term for a heart attack is myocardial infarction. A heart attack causes changes in the normal pattern of the EKG tracing, as shown in the illustration at left. Heart attacks are the #1 cause of death in Western societies. The risk factors for having a heart attack are well known. These risk factors include a diet high in fat and cholesterol, smoking, obesity, inactivity, high blood pressure, diabetes, and a family history of heart attacks. Fortunately, most of these risk factors are related to lifestyle. It is thus possible for a person to lower their risk of a heart attack if they choose to.
The front entrance to the hospital is locked after hours. If you want to enter at this time of the night, you will need to go around back to the rear entrance.